This isn't a normal conference. 50 people who are here by invitation, expert in their field. There's attention both to the background in our Christian faith and those ways of thinking and acting that are appropriate for any healthcare professional.
We want to promote a certain quality and depth of relationship that includes conversation, etc. And lots of things need to be in place for that to happen.
Today within our Western society, the focus is so often on a series of not just technical possibilities, but linked to that a certain economic price for it.
So one thing that doesn't happen at our dinners is once you get halfway through the course, somebody rings a bell and you have to leave. Now in healthcare, that actually happens.
So health can become a commodity and not something that is, as it were, the responsibility of the community for its members.
The way of thinking of medical doctors who are trained from the first years with the anatomy to see the body as an object in front of them, object which is analyzable and measurable. And I try to show that the human body is first a symbolic thing and not a thing.
I have a very close example with my father, bringing him to the doctor, and one doctor not asking him anything but asking me questions because he is now cognitively impaired. So, and when I came out, I asked him, "What do you think about this doctor?" And he said, "This is not a doctor." He didn't speak to me. He didn't ask. He didn't pay any attention to me.
The way Jesus acted as healer, it wasn't just that he cured people of their ailments, it was also that he recognized the person in all that person's suffering.
The rise in complementary, or some call it alternative types of treatment, is exactly due to the fact that patients are craving for that kind of personal relationship. They want to be in contact with a human being who is compassionate and understands what you're going through and joins you in that journey.
And then I brought him to another one who addressed only him and asked him, "What are you doing in your daily life? Are you happy with the way you are living?" And so. And when we came out of the consultation, I asked him, "What do you think about this doctor?" He said, "This is a real doctor. I felt that he had a connection with me and he was interested in me as a person."
How we relate to our patients, do we see them as the image of God? Do we see this relationship we're having as something very precious, sacred, that I'm not going to demean by just treating them as a condition, as another number in a system, as a profit centre.
So there would be a question, I think, these days from a moral point of view of how we treat not just the machinery that we're using and the drugs themselves, which are commodities. They're useful tools, but they are things. But the suggestion that healthcare itself is being commodified.
Do we think of healthcare as children fighting over cookies? It's just a thing, there's a fight over it, once you get it, you consume it, and it's not there anymore. Or do we think of it more like Holy Communion?
The insurance pays per patient, and when you operate on more patients, you earn more money.
These days, people think of patients as consumers, doctors as producers or salesmen, the relationship as being a commodity transaction, and then the health system as a market. And I was asking some questions about whether it's a good way to think of healthcare.
There are 2 less operations with knee replacements. You say, okay, you need a knee because you have pain, yeah, but perhaps it could be in 2 or 4 years, and then to decide, no, we do it now because of economic reasons, and that's dangerous for the whole system.
The development, I think, in the whole question in society today of choice, and usually when we talk about the word choice, I'm talking about it now from the point of view of acting as a consumer. So because I'm a consumer of items, then there is this feeling that I should be able to obtain what I choose, whether it's a medical procedure or anything else.
Now, health professionals risk, like other professionals, being carried along by the tide, so they lose sight of that. And it is just a fight over who gets the cookies. And they need then to reclaim notions like vocation, like the Good Samaritan, like the Hippocratic tradition, things that have shaped healthcare over the centuries as something more than just being salesmen of some product.
And I have to say, it is true that in some respects we do need to think of it as a market commodity. We do need to take into account its economic costs, but the thought that thinking of it solely as a consumer good, in thinking that way we could capture the way that Christ himself was healer, it's just ludicrous.
This is a very unusual time in medical history for the rapid pace of advancement, and a lot of people are intimidated by technology.
There is some expectation that computers, big computers like IBM's Watson or Dr. Google, will actually get better at combining all of that information and coming up with a treatment plan than any individual clinician can.
Patients arrive and they have already asked Dr. Google what he thinks is the right diagnosis or the right assessment and treatment. And there's no priority with Dr. Google, so there are different experts. It might not be the truth, so that means you need much more time to deal with the patient.
What computers cannot do at all is to handle an individual's own life story, his or her own needs, particular values, what he or she hopes to achieve with healthcare.
Technology has to serve the person, has to care for the person, and not to dominate the person.
The whole question of surrogacy, which many people find morally unacceptable, but other people who have infertility problems, for example, will maybe look to a procedure like that so that they can have the child that they want.
Part of the difficulty, it seems to me, in terms of the increase in technology is that the pace at which we move, often fueled by the economic pressures, have negated the reflective need that we have, the increasing reflective need we have to ask that question.
But a problem that has developed from that, and again this goes back to the costs, hidden costs, or maybe not so hidden, or efficiency model, is that people have then turned to women in other countries, so women who are not so well off, and asking them to be surrogates. So there is, if you like, in some countries, what I might call a surrogacy industry, where it's set up so that people know that they can do this.
Some of the technologies like genomics, epigenetics, e-record keeping, touch on profound aspects of how we conduct ourselves as professionals, as patients, as team members.
And we have to be very careful that we don't think that in producing technology we are actually providing good care.
Power has another meaning, the power the person has on himself. And in this power, this power of meditation, of thinking, of leaving space for discernment before taking a decision, to make a decision that can have huge consequences for another person, for instance, for the sick.
What's the vocation of a physician in healthcare today? And how do we link that with something that is deeply meaningful for people who share this tradition? Goes back to this whole notion of the Good Shepherd and how we can see ourselves, our identity is in union with that.
I think that health professionals, like people in many fields, need to go on retreat, as it were. They need it to make spaces every day, every week, every year, every so many years, where they take themselves away from all the pressures of their work and the institutions and community they're in, just to stop and rest and think, what am I doing this for? What is it all about?
And so the more guidance that you have, the more that you can turn to the church, the more that you can be able to discuss things openly and try to bring about the change that is needed to give ethical health care to patients is the most important point of doing this.
I think clarity at the end of the day avoids crisis management. We all have to die, and when that moment approaches for us or for a relative, it's good to go to a situation knowing already what your moral teaching says, as it were. And it's good for us health professions to know what can and cannot be done, both under the moral aspect and also under the law. So that's the clarity, and I think that clarity will provide better healthcare.
So that when we're healing, it's not just a mechanical activity of engaging in using chemicals to affect a material body or other techniques. Those are important, of course. But there's something much more precious happening here. You're touching the divine, because we know that the mysteries of life and death, of life after death, of health and how it's maintained or regained when it's lost, these are mysteries over which health professionals have a certain wisdom, a certain control, but in the end they're much bigger than them. And in being part of that as a health professional, as a doctor, nurse, physiotherapist, whatever, you're part of something much bigger than yourself, that is touching the divine, that is being the hand of Jesus Christ, reaching out to somebody and touching them and bringing them healing.